Good afternoon, everyone, and welcome to our weekly press conference dealing with the COVID-19 emergency. Again, we're streaming live on the county's YouTube channel and on the County Health Department's Facebook page. I will go ahead and turn things over. Well, first, let me introduce the folks that we have on hand. We are minus our two mayors this afternoon. They have another commitment. We have Dr. Bean from IU Health. Dr. Jeremy Adler to my immediate left. I'm Commissioner Tracy Brown, and then Dr. Wickert from Franciscan Health seated to my right. So with that, we'll go ahead and turn things over to Dr. Adler.
Okay. Thank you, Commissioner Brown. Good afternoon. Welcome everybody to our weekly press briefing. Today I'd like to begin the press briefing with a discussion about face masks. As you can see, all of us here brought our face masks along. We were all wearing them on our way over here, and when this meeting's over and we leave, we'll be putting our masks back on. As we've been stressing to everybody, it is very important that all of us wear masks when we are in public settings. This is a very important tool to reduce the transmission of COVID-19 in our community. And the importance of wearing masks was highlighted last week when the IU School of Public Health released data from its first phase of its COVID-19 research study that was done here in the state of Indiana. For this research study, the IU School of Public Health tested 4,600 randomly selected Hoosiers, including people here in Tippecanoe County, who were tested for COVID-19. And there were several key pieces of data that were discovered in this study. First, the prevalence of COVID-19 in the state of Indiana is 2.8%. That translates into 186,000 Hoosiers with COVID-19. Here in Tippecanoe County, 2.8% of our population is 5,400 people. Among individuals who tested positive for COVID-19, 44.8% had no symptoms at all. They were asymptomatic. They had no idea they had COVID-19. That's nearly half of people positive were asymptomatic. They were able to determine also that the infection mortality rate for COVID-19 is 0.58%. That is 6 times higher than the mortality rate for influenza, which is 0.1%. The data on asymptomatic carriers of COVID-19, with nearly half of people testing positive not displaying any symptoms, really highlights the absolute importance of wearing masks when in public settings. When I wear a mask in a public setting, I am helping to protect those around me, just in case I happen to be one of those individuals who is carrying the virus but displaying no symptoms. In turn, when other people around me wear masks, they are protecting me in case they are an asymptomatic carrier of the virus. So masks work if everybody is wearing a mask. It's a great tool, a very important tool for all of us to use to reduce the transmission of COVID-19. The wearing of masks is, of course, recommended in Governor Holcomb's Back on Track Indiana plan, and it's been a measure that we have been emphasizing here at these press briefings for several weeks. In addition, since we are in the reopening phase of our community, currently stage 2 of Governor Holcomb's reopening plan, we need to also continue maintaining a social distance of 6 feet when in public settings. We need to frequently wash and sanitize our hands and disinfect high-touch surfaces. Currently, we need to limit social gatherings as directed by Governor Holcomb to up to 25 people while following social distancing guidelines. This number will increase to 100 people starting on May 24th when we progress to stage 3 of Governor Holcomb's Back on Track Indiana plan. In addition, it's important to remember that individuals age 65 and older and those with high-risk health conditions should remain at home whenever possible. Businesses that are reopening should modify their operations and their workplace environments to optimize social distancing and protect customers and employees. In addition, businesses need to establish plans to regulate customer capacity per Governor Holcomb's Back on Track plan. That is currently 50% capacity. That will increase to 75% capacity on May 24th. It's very important that as we reopen our community and our state, that we remember that the COVID-19 pandemic is not behind us, and it is absolutely imperative that we remain steadfast and vigilant in our approach to this pandemic. So now more than ever, we all must be smart and cautious and act responsibly. We do not want to let our guard down now and endanger ourselves or others. The Health Department, of course, will be monitoring the COVID-19 pandemic in Tippecanoe County and may issue additional recommendations or requirements if necessary. As of today, the COVID-19 pandemic has infected more than 1.5 million people in the U.S., with 91,000 deaths in the U.S. Here in Indiana, we have 29,274 confirmed cases of COVID-19 with 1,716 deaths. Here in Tippecanoe County, as of today, we have 331 confirmed cases, and it is with great sadness that we report that we have had a third death in our county due to COVID-19. This was an individual who was over the age of 60 and had several high-risk medical conditions. As I mentioned last week, here in Tippecanoe County, our highest affected age groups by COVID-19 are individuals aged 20 to 29 and aged 30 to 39, accounting for 22.1% and 21.5% of positive cases, respectively. Testing capability continues to increase here in Tippecanoe County. Well over 5,000 individuals have been tested in our county. In addition to the hospital testing sites and our commercial lab testing sites, the Indiana State Department of Health free testing site remains open. It has moved from the National Guard Armory to the Evangelical Covenant Church located at 3600 South 9th Street in Lafayette. It is open Monday through Friday from 8 a.m. to 8 p.m. Testing is free, but it is by appointment only. So individuals who are interested in testing should register either on their website or by telephone. That site is providing testing for individuals who have symptoms consistent with COVID-19 and also individuals who are asymptomatic if they are at high risk because of age, being over 65, have diabetes, obesity, high blood pressure, or another underlying condition. If they are a member of a minority population, that's at greater risk. If they are pregnant, or if they are a close contact of confirmed COVID-19 positive patients. The Tippecanoe County Health Department continues to closely monitor several data points with regard to the COVID-19 pandemic in our county. The first, of course, is the number of new confirmed or suspected COVID-19 cases in Tippecanoe County. The second is the percentage of COVID-19 tests that are positive. That percentage is currently 6.5%. For the state of Indiana, that percentage is 15%. Nationally, the percentage is 10.2%. So we remain under both the state and national percentages. We also, of course, monitor closely the number of hospital admissions and intensive care unit admissions for COVID-19, and also the number of ER visits for respiratory illnesses. ER visits in Tippecanoe County for respiratory illnesses did decrease from April 5th through May 10th, but just in the past week have increased some, though not as high as they were in early April. In addition, of course, we are also monitoring the number of deaths in our county due to COVID-19, and as I mentioned, we have one additional death to report today. There are several modeling, statistical models that are available to predict the course of COVID-19 both nationally and in the state of Indiana. These models do show or do predict an increase in deaths in Indiana due to COVID-19 through early June, with a range between 2,000 and 3,500 predicted. So again, this is another reason why all of our protective measures, social distancing, masks, hand hygiene, are all very important and remain very important as we continue our journey through the COVID-19 pandemic. The CDC last week announced the discovery of a very concerning consequence of COVID-19 among children, a condition called multisystem inflammatory syndrome. This is a very serious health condition that has been linked to COVID-19. It involves problems in multiple body systems and multiple body organs, resulting in children becoming critically ill from COVID-19. There have been over 100 reported cases of this in the state of New York, also cases elsewhere in the U.S. such as Oregon, Illinois. Here in Indiana, we've had one confirmed case of the multi-inflammatory syndrome in a child. That child was hospitalized at the Riley Hospital, as Dr. Box has described in her briefings with the governor. The last topic that I wanted to touch on briefly is a topic that we've received a lot of questions about at the health department, and that is recreational sports leagues. The governor's Back on Track Indiana plan specifies that recreational sports leagues may resume on June 14th. Until we learn otherwise from Governor Holcomb, we interpret that date to also be the date that practices can begin. We have heard that Governor Holcomb will be providing further information and further details about recreational sports and their practices, and so we are awaiting that information from the governor. The health department will be putting together some guidelines for recreational sports leagues, and we hope to issue those guidelines in the near future. That concludes all of my remarks for today. At this point, I'd like to turn things over to our other panel members if they have anything they'd like to add.
So Jim Bean again from IU Health Arnett. I'm the Chief Medical Officer there. Just a couple updates. Our hospital's stable. Our patient volume has decreased a bit from where we were last week, so we're back down into what we categorize as phase 2 of our surge plan. So that's a good thing. We're stable in equipment and stable in our availability of personal protective equipment. And we have been, over the last week, cautiously expanding our elective cases and setting a plan for gradually expanding more face-to-face visits within our clinic practices. I was really pleased to hear your strong admonition for masks. And what concerns me for us over the next weeks is 3 things are falling into place at the same time. We're going to phase 3 of the governor's plan, just as 4 things, just as the weather's starting to get better and Memorial Day is coming and graduation celebrations are here. And I just want to really emphasize the essential need for us to stick with the plan that Dr. Adler just described. If you're going to host a gathering over Memorial Day or graduation celebration, please have hand sanitizer available for your family members and your guests. Please, if you have access, get masks for people who may show up without them. This is going to be a very high-risk time for our region as we get back to trying to engage and open up, that could, a week or more from now, put more and more pressure on the most vulnerable in our community and on the healthcare facilities trying to meet their needs. I'll pause there.
Thank you, Dr. Bean.
Yep.
So to give you an update of what's happening at Franciscan, we, as of this morning, have 19 positive patients in the hospital and another 13 individuals who we are under investigation and ruling out as suspect patients. Happy to report that we have no one who's on a ventilator who is COVID positive at this point. And we've had a number of individuals who have been on ventilators for a number of days now who have been able to come off the ventilator. So we're very encouraged by that. We do have 4 individuals who we're investigating who are on the ventilator, but just to kind of give an update of where we're at currently. I think one of the messages we'd like to make is that I think as hospitals, we are going to have to learn how to do 2 things at the same time. We're going to have to learn how to take care of individuals who are COVID positive or suspect or rule out. They're not going to go away. They're going to be with us, and we'll have people in the hospital probably for the foreseeable future that are either positive or suspect that we're investigating. We have to learn how to do that well, and also how to take care of individuals who are not suspect or do not have COVID, who are not COVID positive. And under that, we're working very hard to make that environment safe and effective for both groups of individuals. And again, I'd just like to reiterate the importance of appropriate medical evaluation for individuals who need medical evaluation. We continue to hear stories on a daily basis through our emergency room, particularly of individuals who needed care and delayed care and suffered consequences because of their delay in care. So the concern is if you need care, if you are symptomatic, if you have a chronic condition and need follow-up, please see your doctor. Please come to the emergency room if that is a necessary component of what you need to do, or go to the urgent care. So please do not delay care because of the concern of, well, I don't want to go to the hospital because that's where the COVID virus is. And so we really want to encourage people to just, if you need care, please come and get appropriate care. One of the other things that you will see is as we are, both hospitals are opening up, and we're now into a little more than 2 weeks into our opening up and some of our elective cases, we are requiring any individual who does have and is scheduled for an elective procedure, elective invasive procedure or surgery, that prior to the procedure, they will have a test to determine that they are negative prior to their procedure for COVID-19. So we will see numbers go up as far as testing, and we're really happy about the capability of our testing that continues to increase. And we are pushing on that because as we open up and do more elective cases, we are having those individuals have testing prior to their procedure. We continue to follow closely as our hospital, as a system, regarding our personal protective equipment, and we are watching that carefully, but at a good place at this particular point. So we continue to watch all of those variables as we move forward. Thank you.
Thank you, Dr. Wickert. Commissioner Brown?
Well, on behalf of the Board of Commissioners and the mayors of our 2 cities, but thank you again for not only being with us today, but working through this process with us. I guarantee you that there's not a person in this room that doesn't want more normal than we have right now. And it's coming. We have no way of predicting when it's going to come, but we absolutely know that if we don't stick together, and we have people not doing just the little things that they should be doing, that it's going to slow the recovery. It'll slow the recovery in terms of healthcare, and it'll slow the recovery in terms of our local business operations as well. To share with you basically what is happening in county government and city government alike, we are all planning to open our doors as much as we can, starting the 26th, the day after Memorial Day. and business will continue to be different than it has been in the past. We still strongly encourage citizens, if you can reach out to us for the services that you need. If it's paperwork type services, we have obviously proven that that can be done remotely through email and phone calls and things like that. And that is probably the new norm for us moving forward. If you have to come into our buildings, again, we want you to pay attention to signage posted at our front doors that are going to provide some things for you to think about in terms of your current health status. And, you know, if you had a fever, those types of things. And we are making hand sanitizer available at nearly every office in county and city government. And again, want citizens to take advantage of that being provided for you. The one exception to that 26th opening will be anything that is part of our judicial or criminal justice system, meaning primarily the courthouse and the 111 building downtown. Those will remain in the status that they're in right now, which is by appointment order only until the first day of June. So we have two different dates that we're looking at in county government. And I want to echo the sentiment of Dr. Adler and Dr. Bean and Dr. Wickert. I mean, you have to take a layered approach. I know there are folks out there, I've talked to them, who don't, you know, they've read masks are good, masks don't work. The bottom line is, folks, it's easy. If you can, the toughest thing is sometimes finding them, and that is getting better. It's even getting better for us. But if you take a layered approach and be sure that you are maintaining distance, stay away from people who are ill, obviously, and wear a mask and wash your hands and don't touch your face. If you do all of those things, it significantly reduces the opportunity for you to be a victim of the virus. And again, this is more about protecting the people around you than it is protecting you. So I'd be the first to admit that they are uncomfortable, and I try to, I put it on if I'm going to be out in public. When I'm sitting at my desk and there's no one else around, I don't have it on. But if you can just be smart, take the layered approach and do all of these things. We recognize this time of year, it's going to be a little more difficult because this is the out and about time of year, and it's the time of year where people are collecting at events and things like that, where there are a lot of people. But we need to buckle down, and this is a time that we really need your help. I want to close by saying, before we start taking questions, Dr. Adler and his staff, Dr. Adler, Dr. Wickert, Dr. Bean, all of their staffs, Amanda, Kayla, and the health department, these folks have been on nonstop for weeks. And they don't get a lot of thanks for that, but we appreciate your work. It means a lot, and there'll come a time for us to celebrate that together. Unfortunately, it's not right now, but oh, goodness. And also, two people at the back of the room, if I'm handing out thank yous, Max Walling, Paula Bennett. We have had them working so far out of their job descriptions in the last few weeks to bring this broadcast to everybody on a weekly basis. Not only this, but our public meetings that are streamed and everything. So they deserve absolutely all of the credit for making this happen. So with that, I'll turn it back over to Dr. Adler.
Thank you, Commissioner Brown. I did want to make one additional comment. Commissioner Brown had mentioned that masks are not always easy to find, and I wanted to mention that the CDC website actually has a great, easy to follow set of instructions for making your own masks at home. They have 3 options on there. 2 of the options do not require any sewing at all. They utilize a t-shirt and a bandana and show you step by step with easy to follow diagrams of how to make your own homemade cloth face mask. So that's on the CDC website, and that's a great resource to help provide and make masks for everybody. With that, we will take questions from the media and also from our Facebook Live.
Hello, everyone. I'm Anna Darling from WLFI. Several Indiana cities have already canceled their 4th of July celebrations and plans. Is there any such plan here for Tippecanoe County?
We are in discussions about that very topic, and hope to have a decision about that sometime next week.
Anna Darling again. Stage 3 is set to start on Saturday of the governor's plan. Is there any plan for us to deviate off of that plan? Are we still going with those recommendations from the governor? Yeah.
Okay. Yes, we are on track to follow the Stage 3 guidelines created by Governor Holcomb. As we've said all along, we're watching all of our local data very closely, the multiple data points that I had mentioned. And if we see any concerning trends, then we may need to instate additional recommendations or requirements based on our local data. But we are going to proceed with the Stage 3 as outlined by Governor Holcomb.
Question from Facebook Live. One of Governor Holcomb's guiding principles for reopening various sectors of the economy is that the number of hospitalizations for COVID-19 has decreased for 14 days. Is that criteria satisfied in Tippecanoe County, and is any data publicly available on hospitalizations for COVID-19, either statewide or in Tippecanoe County?
So the data for hospitalizations statewide is available on the Indiana State Department of Health COVID-19 dashboard. They have some nice infographic representations of that. As for local hospital data, each week at this press briefing, Drs. Bean and Wickard are kind enough to share with us their hospital data. We've been, I think, fortunate in our county to so far have had a relatively low incidence of hospitalization for COVID-19. Those numbers tend to remain stable from week to week with small changes up and down as one would expect. What we're of course watching for is a significant increase in those numbers. The 14-day decrease of hospitalizations is not as easy to attain when the numbers of hospitalizations is relatively low. Drs. Bean and Wickard, I don't know if you wanted to add anything to those statements.
Well, what I referenced earlier, I didn't give a specific number, but we have 6 patients in the hospital with COVID-19 as of early this morning. So, as I said, down from our peak of the last couple of weeks. My assessment of the volume of patients we've been taking care of is that it's really been relatively stable over the last many weeks. And I agree with Dr. Adler's comment that it's hard to, to see week over week improvement when our numbers are relatively small to begin with. But my assessment is it's pretty stable, especially when I know what's going on in our colleagues' facility across town.
Jordan Smith, the Purdue exponent. With in-person voting, early voting starting next week in the election, June 2nd, I'm just wondering if voters who show up without masks will be given masks by poll workers, and what else the health department is coordinating with the Board of Elections to provide.
Commissioner Brown, do you have any comments about the Board of Elections?
Absolutely. It is my understanding, and I don't know the specifics of what came in with the shipment, but our local Board of Elections did receive a significant amount of PPE, hand sanitizer, and I'm going to make the assumption that that included masks, but I haven't actually seen those or talked to anybody about them, but enough that we would have that on hand for the elections, because obviously you have to touch the election equipment. And in talking to Julie Roush, I know that even prior to that shipment arriving, she had been able to acquire Clorox wipes and things of that nature. So I'm very confident that we'll have ample supplies on hand come Election Day. We also are seeing that a lot of people are voting by absentee ballot this year as the process has allowed. And I might remind everyone that those applications actually need to be turned in to the Board of Elections by 11:59 tomorrow. And then after that, if provided that you get those turned in on time, then you receive an absentee ballot by mail, and then you have up until noon on Election Day to have that in the Board of Elections office. Since we are talking about elections, and we are just a couple of weeks away from that, early voting starts at Tippecanoe County's early vote sites beginning on the 26th. And that information can be found on the Tippecanoe County government, both the website and our Facebook page, if you have any questions about that. It's better that you do that than call the Board of Elections right now. We would ask that if you can get that information online, it's easier for them because they are being obviously inundated with a lot of calls and a lot of applications for absentee ballots.
I have a question for the doctors regarding the disease that's being found in the children. Is there anything parents should look out for symptom-wise? Is there any kind of message to parents about not being afraid to bring your children in if they are having these symptoms? Is there anything you'd like to say about that?
We're very fortunate that Dr. Bean is a pediatrician.
And Dr. Adler is a family physician?
We'll start with Dr. Bean.
Okay. So I'll just emphasize what we heard earlier. It's a very significant illness in a small number of kids. One of the early symptoms is very significant fever. It's not a subtle illness, so my recommendation would be if parents are seeing signs of their child getting sick, reach out. And the pediatricians and family physicians are available to engage and to help answer the question whether you need to be seen or not. Other symptoms that have been associated with it that would be visible to a parent would be some children or many children have rashes, but they feel pretty darn lousy. And so behavior, fever, rash, it's not in stomach and intestinal symptoms, vomiting and stomach pain. It's not maybe what we would have thought starting off with respiratory symptoms, that tends to be less likely. Can I go off on a tangent?
Of course.
The other thing that we're worried about, not related to this specific syndrome, but related to hesitation and lack of access to primary care, is the number of children who are missing or having delayed their immunizations. And nationally, we're starting to see the rates of preventable diseases, immunizations for preventable diseases drop down because of this. So I want to encourage people to reach out to their primary care providers and make sure that we're doing all we can to help you keep your child up to date on their vaccines. We're available to do that.
Great comments, thank you. What I would add is that, for a long time with this pandemic, the emphasis has been on protecting older individuals, people who have chronic medical conditions, and preventing those individuals from getting COVID-19. And certainly that remains a very important priority. But I think the appearance of this syndrome in children does highlight that COVID-19 can infect children and can have very serious, even life-threatening consequences. So we all need to really act responsibly to protect everyone in our community, including children. And children are vulnerable to COVID-19, and unfortunately in some instances, although a low number, they can develop very serious consequences of COVID-19.
Question from Dave Bangert. Dr. Adler, are there specific parts of the next stage of back on track reopening that have you concerned, including parks and pools?
I think that as we've discussed before, as we reopen and as we progress through these stages of reopening and more things become open, more activities are available, more businesses are open, there is, of course, an increased risk of exposure to COVID-19. And that's why, as we go through this reopening process, the measures that we've been emphasizing here for the last several months are even more important now than ever. Social distancing. When you're out in public, keeping that distance of 6 feet or more between yourself and other people outside of your household. Wearing masks. Masks work. If we all are wearing them, we can protect each other by wearing masks in public settings. Frequent hand washing, frequent disinfecting of high-touch surfaces. All of these measures are going to be even more important as we reopen, and those are the best tools we have to make the reopening successful. What we don't want to happen is that we have to take a step backwards because of a large increase in case numbers or in hospitalizations, and we all have the opportunity to be active participants in that, and we can all act safely and cautiously and be smart about this and act responsibly. We can make the reopening process as safe as possible. But yes, of course there's concern as more things reopen and we get involved with more of our normal activities that there could be, of course, more exposure to COVID-19.
Question from Facebook Live. Will people having elective procedures also be tested when they leave the hospital to make sure they have not become infected and be asymptomatic?
I will let Drs. Weckert and Bean answer that question.
At this point in time, we are not performing tests when people leave the hospital. So those tests typically are being performed anywhere from 2 to 4 days prior to their procedure. So, and oftentimes the elective procedure will be one that's an outpatient, so they'll go home the same day. So we are not doing a test as they leave the hospital.
Same. Not doing a test when they leave the hospital before the procedure, yes, but I will also emphasize that we are implementing and continue to implement really effective infection prevention practices within our hospitals and within our facilities to make the likelihood of sharing this germ and other germs in a hospital as low as possible.
Thank you.
Question from Dave Banger. How has the first week or so of restaurants and retail reopening going? Are there any violations the health department has to chase, or how many have been?
So far, I think it's gone well. I have not been informed by our foods staff of really any issues with restaurants. There was, of course, the issue with a long line of customers at a bar near Purdue last week, but that issue, as we discussed last week, has been addressed. And as far as I know, everything's been going smoothly. Retail establishments, the health department does not routinely inspect retail establishments unless they provide food or tattoos. We often will get, sometimes we'll get complaints about establishments. We haven't really received any about particular issues at retail establishments. So I think to us that's a good sign that people are trying to do the right thing and go about this in a safe manner.
Question from Facebook Live. What percentage of out-of-county COVID cases are in the 2 local hospitals?
I don't know the location of origin of our patients.
And I can't tell you a specific percentage. We do take care of individuals from surrounding communities, as both hospitals do. But I don't have a percentage of those who would be in our hospital who would be from outside counties outside of Tippecanoe.
Another question from Facebook Live. Would you consider having one family member have access to suit up and be with the ill or dying loved ones?
That's a great question. I think nationally, for healthcare organizations, limiting visitors, especially in end-of-life situations, has been one of the most difficult decisions that we've had to make. I can say that at IU Health Arnett, we have a process, and throughout the IU Health system, we have a process that does allow for visitation of patients with COVID-19 who are dying for visitation of loved ones to come. It's limited, and it's a time-limited, chaperoned visit. We help people don and doff their PPE and accompany them to the bedside during that time, but we're trying to accommodate, at least to some degree, in particular at that time.
In a similar fashion, we have policies in place that would allow individuals at end of life, both either positive for COVID or non-COVID, to allow, again, a limited number for a limited time period, assisting them in putting on and taking off all of the PPE, but a similar process that we have at Franciscan also.
Question from Dave Banger. Does Tippecanoe County plan to give details about nursing home cases or how many there have been?
The fortunate thing for our county thus far is that we have not had any confirmed positive COVID-19 cases in nursing homes in our county. And I think that's in large part due to the excellent job that all of our facilities have been doing in terms of visitor restrictions and screening their staff and monitoring their residents very closely. So we hope that trend will continue. That's obviously a vulnerable population, and we are hopeful that that trend will continue.
Question from Emily Seiberg from WBAA. Since gatherings of up to 100 people can start on Sunday, and given Dr. Bean's point about Memorial Day and graduation gatherings in warmer weather, is it realistic to think that a group of up to 100 people can safely social distance?
I mean, I think that depends on the group itself and the setting that they are gathering in. As groups get larger, of course, social distancing becomes more difficult, but it is something that we all need to take very seriously. And if people are organizing social gatherings of that size, they really need to put a lot of thought into the setting of the gathering and what arrangements can be made so that social distancing can be optimized.
And the availability of masks and hand sanitizer for your
Yes.
guests.
Great point. Thank you.
Jordan Smith, Purdue Exponent. Dr. Adler, you mentioned the IU public health study.
Yes.
I believe it found, you said 2.8% prevalence among the 4,600 random tests, which would be 186,000 Hoosiers. Do you think a study like that is enough to call into question the somewhat fast reopening plan that the state is currently on?
That's a great question, and when that data was shared by the IU School of Public Health, it was actually shared at Governor Holcomb's press briefing last Wednesday afternoon. They had the two investigators from IU there who were able to share that information, and I think at that time those investigators, to my knowledge, did not make a recommendation to the governor, and the governor did not indicate that he was going to change his plan based on that. But it certainly does make us all more aware of just how much COVID-19 is here in Indiana, and really emphasizes the fact that we need to be very cautious and smart as we progress through the reopening.
Question from Facebook Live. Can anyone be tested now with the asymptomatic population? We're just wondering how to get tested.
So the free State Department of Health testing site that is currently located at the Evangelical Covenant Church at 3600 South 9th Street in Lafayette is testing asymptomatic individuals who meet certain criteria. And those criteria are if an individual is at risk because of age, being over 65, if they have diabetes, obesity, high blood pressure, or another underlying condition, if they're a member of a minority population that's at greater risk, if they're pregnant, or if they're a close contact of a confirmed COVID-19 patient. So if you are in one of those categories and asymptomatic, you can be tested for COVID-19 free of charge at that testing site. You do need to make an appointment before showing up there, either online or by telephone.
Some businesses are not letting patrons in without masks. Some larger ones that are essential, like grocery stores, are kind of just counting on people to wear them, but they seem to have to let all in. Should businesses prevent people from coming in without masks or provide them to those who don't have masks on?
You know, obviously, we think that everybody should be wearing masks. We've been saying that all along here, and that includes, of course, customers at stores and other businesses. It's whether it's required by a business for their customers to have a mask on to enter their business is really a decision for the business to make. Certain businesses, employees at certain businesses are actually required to wear masks under Governor Holcomb's plan, and those are restaurant employees, grocery store employees, employees at personal service businesses such as hair salons and nail salons, employees at professional offices such as medical offices, and also employees at manufacturing and industrial facilities per their industry best practice guidelines. So there are requirements there for employees, but it is up to the business if they want to require that for their customers. Of course, we recommend that everybody be wearing masks in public settings, and that's just a smart, cautious way to protect everybody and reduce the transmission of COVID-19.
Question from Facebook Live. There have been some reports on the Greater Lafayette COVID-19 mutual aid response page of people showing symptoms and having difficulty breathing, but state the paramedics were unable to take them to the hospital because they did not have child care for their children. What would you suggest those families do? Is there an organization that could help those families?
That's an excellent question. Yeah, I think a good first step would be calling the health department because we often can help in those situations. We have connections with various community organizations that might be able to step in and provide some assistance.
Question from Emily Seiberg from WBAA. Under the guidelines of Stage 3, places such as playgrounds, tennis courts, and basketball courts can reopen with social distancing in place. Since these are spaces that involve more physical activity, how does that change social distancing guidelines, and how is social distancing possible on a basketball court during a game?
Well, you know, in those settings, social distancing is difficult to maintain, and that's where wearing a mask comes into play. because the masks are there to help us, especially in settings where social distancing is not always possible. So I would recommend that people wear masks when they are on the playgrounds, on the basketball courts, tennis courts. That's the smartest thing to do, just like it would be in any other public setting where social distancing is difficult.
Question from Facebook Live. It has been said that the governor is to give an update today on rec leagues and practices in particular. Is Tippecanoe County and the Parks Department prepared to open baseball fields to allow practices if the governor says May 24th these programs can start practicing?
Well, as far as the baseball fields that are located in city or county parks are concerned, that would be up to the leadership at the city and county level. Also, it's worth noting that at this time, all school-based grounds and facilities are closed and will remain closed until June 30th under Governor Holcomb's order. So there would not be able to be any sort of practices or games that take place on school grounds or school facilities. The governor is expected to make some sort of an update on recreational sports leagues and practices and when those can begin. We have not heard what that update is going to be. At this time, we are operating under the interpretation of his Back on Track Indiana plan as meaning that recreational sports leagues can't start until June 14th, and that would include practices also.
Another question from Facebook Live. With 331 cases in Tippecanoe County as today with a rate of 25% increase in number of cases in the last few weeks, can we assume we are being hit by a delayed peak of COVID cases in the county?
It's always a possibility, and we watch those numbers from day to day very closely. And one thing you'll notice if you look at the day-to-day new case data, it goes up and down. We'll have days where we have a larger increase in new cases, such as today it was 18. Yesterday, I believe it was 6 or 8, so it was lower. And so it goes up and down. And what we look at is the overall trend and whether we're seeing a consistent or persistent increase in those daily new cases. So we're watching it very closely and taking that into consideration, as we make our decisions and come up with our plans.
Our last Facebook Live question, how will you help protect workers from angry patrons who refuse to follow safety protocol and wear PPE?
Well, I think I would encourage, of course, any worker or member of the public who feels threatened in any way to notify the police, just as you would for any other situation. And that would be, I think, the most prudent way to address that. Commissioner Brown, do you have any comments about that as a former sheriff?
Well, I can tell you it is very difficult to legislate common sense, okay? I know I've got friends out there that think that the whole mask thing is absolutely bogus, and I'm just going to tell you, you're wasting your time and energy to go against what has become the norm. I understand they're not easy to come by, but there are more and more outlets out there where you can purchase them, keep them in your car, keep them in your office. Virtually everywhere I go, I see people wearing masks. It wasn't that way 3 weeks ago. So it is not worth it is not worth getting into a fist fight over whether or not you're going to put your mask on. It is also not worth having to tax an already taxed criminal justice public safety system over making an argument over something that there simply should not be an argument over. So use good common sense. If I didn't want to wear a mask and I knew I was going into a place that was going to require it, I'd simply find another place to do business if I felt that strongly about it. You always have the choice. Just use good common sense in your choices.
Thank you. Great comments. I think that concludes our questions for today. So I'd like to thank everybody for attending, and we will see you next Wednesday. Thank you.